once that opens up, we can make a start. But just to give you some context for where I'm coming from with this session, as some of you might know, my background is in medicine. So I've been practicing as a doctor for 2 years before I started working in public health. And I'm sure many, if not all of you, will have had an experience with a doctor, probably GPs, as that's the doctors we see the most, where they've not necessarily grasped what you're trying to tell them, or they've told you something poorly, and a situation which felt very avoidable and generally quite dissatisfying. And it's impacted on the care that you've received, and it's left you feeling vulnerable and uncomfortable. When you've got health information, or if you've got health knowledge about someone, you're automatically in a position of power over them. And that's not a bad thing, but it's just something we need to be mindful of and respect. So the framing of this session is very much around contact tracing and having test results for people that you might be calling up and delivering the test results. But it's going to be, the skills that we'll talk about will be applicable in a much wider context than that. The presentation still isn't coming up. Let me just try that again. How's that? Can everyone see that?
Yeah, I can see it, Neil.
Yeah,
I can see it.
Lovely, thank you. So, 3 main things we're going to go over today is firstly how to plan your interaction, how to plan the kind of encounter where you're going to be delivering some information, how to actually get across and think through the key messages that you need to put across during that encounter, and then talking about some sensitive discussions, how to anticipate some of the problems that might come up, how to avoid the most common pitfalls. But through all of that, the most important thing is just being human and just being aware that the things that are being talked about in that encounter are personal to someone, that even what seems like mild and normal information can be upsetting to people, and essentially that sometimes you have to roll with the punches of whatever people will throw back at you, and just being sympathetic to the people that you're talking to. So, Joe, are you on and ready?
I'm on and ready, Neil.
We're going to just quickly act out a scenario for you all to see what it's a little bit like to be delivering some of this information. So, hi, is that Joe I'm speaking to?
Yes, it is.
Hi, it's Neil calling from the council. I'm just calling about your COVID test that you had the other day.
Okay.
It's just to let you know that you were positive. And also at the same time, your partner too, they were positive as well.
Sorry, can you say that again?
Your COVID test results were positive. So you've got the disease.
And my partner?
Yes, both of you.
But he's not ill and I'm not ill, so I don't understand. I don't understand.
Well,
what do I...
Sorry, you had the test done and it's come back positive, and not everyone gets all the same symptoms. It doesn't mean you're going to die or anything.
Well, I don't. But how do you know that? I don't know that. There's nothing the matter with me. I'm really confused.
Well, I mean, I'm sure you'll be fine. If you're fine, then don't worry about it.
My partner. I mean, he doesn't know. I don't even know. He doesn't know. He's not said anything. So he knows and he hasn't told me.
No, I don't think he knows. But if you could let him know, I'd be very grateful. It'll save me a call.
Well, he's at work. What do I do? He's at work now.
Oh, yeah. So you both have to self-isolate for 7 days now. You have to.
But he can't. He won't get paid. I won't get paid. What do we do?
Well, you can get sick pay for 7 days.
I can't take this in. I'm really, really worried now. I'm really stressed. I don't know what's happening. I didn't expect this at all. There's nothing the matter with me. I don't know what's going to happen with him and his job. I need some help.
Well, I'm really sorry. I can't give you that help. But if you've got any worries, then you can call 111 or your doctor.
I can't do that. You can't just leave me like this now.
Okay. And we'll pause there before Jo completely eviscerates me.
Thank you, Neil.
Thank you very much, Jo. So that's how not to do it. And that's, it's extremely rare that it will go, anything goes as badly as that. And I can think of one time in all my years of training when I had a consultation that went poorly. And again, it was just because I blundered into it and I didn't plan it. And it's easily avoided, and it's very unlikely that you'll have something like that. But stopping and planning and thinking through what you actually need to do will really help. It will smoothen things out. And these kinds of communication skills are things that everyone can learn. Absolutely everyone. There isn't any kind of natural talent to it. It's not about even the most awkward doctors that I trained with were able to deliver really good and smooth consultations by just learning some simple communication skills. So first of all, just talking about how to actually plan any kind of consultation. What I've got up here is just a flow chart of the different steps that you want to go through when you're planning an encounter. So you've got this test result that you need to give to someone, and you've got a little bit of information that you need to give with it. The first thing you need to do is actually introduce yourself properly. My introduction earlier was appalling. There was no reason for Jo to believe that I was from the council. I had no idea who Jo was. I never checked to stop and see that she was the right person that I was speaking to, and I didn't really establish any ground rules for the whole encounter. I didn't let her know what to expect. I didn't give her any choice in the matter. It was bad. So we'll go through how to do that a little bit more in a more structured way, and just how to think through. You can use the same introduction every time, but it'll make it easier in this kind of situation if you know exactly what you're going to say the first few sentences. Once you've done your introduction, that's what I often find is the best time to actually start gathering some information, asking a few questions from the person you're speaking to make sure that you're both in the same place, that you're both coming at the same direction, and to kind of let you plan where you're going to go to next. So the first thing I could have said to Jo, has she had any symptoms? Has she been unwell at all? Is there anyone else in the house with her? Do they have any more? What is going to be the impact of the information that I'm giving her? And then you can actually deliver the information, and I'll give you a structure for that, for how to think about that, and how to tell someone that they've got this test result in a sensitive way, because it can feel very blunt to just say you're COVID positive, and it doesn't mean a lot. But at the same time, that can be very scary. But you don't really want to soften the information and try and pretend that it doesn't, or hide it, or you want to avoid making it seem like it's not important, or that it's not very meaningful. Finally, once you've given all the information that you need to, you make a plan and potentially help negotiate it with who you're speaking to. That, again, this will be very straightforward in this context. It will be a matter of saying you need to self-isolate for 7 days from the first day you had symptoms. What day did you have symptoms on? It was 2 days ago that Jo may have started with a cough. And so that's the day that she self-isolates from for 7 days. And that's, just making that plan and making sure that it's an interaction that's done together with the person you're speaking to, and not just feeling like they're being dictated to, makes it a bit smoother and make sure that you're telling them the right information. Finally, once all that's done, you close the interaction, you tell them where to go for any more help or any more questions that they've got, and then documenting all the information that you've delivered and gathered becomes important. Any questions at this point? Yeah, I agree that was an excellent performance, Jo. I was quite nervous for a moment then. So again, while I'm drawing this from the medical experience, which is more complicated and there are many more variables that can go wrong, delivering this kind of information, doing contact tracing, it will be more straightforward, but this kind of structure is still really, really useful for that. Also, anyone who is asked to do anything like contact tracing or delivering test results will get an in-depth script, lots of information, more specific kind of context to what that particular task is. But this is just going over the broader skills of how to actually talk about people's health to them where you've got that position, you're in a position of power, and they are somewhat reliant on you to structure the conversation for them. So first of all, and the other thing to mention is that sometimes information gathering, if you're delivering a result and doing some giving some details about contacts, it's often better to split that into two. So you gather information about the positive case, you give them information about the case you plan and negotiate, and then you go back and ask about contacts and deliver information and plan and negotiate, so that you've got a clear distinction between the bit that's about them and the bit that's about other people, and you're not mixing it in together. And that way it just feels a bit more natural that, you know, this person's waiting to hear, do I have COVID? And you're asking them about whether they've been to the shops in the last 2 days or something. That won't feel relevant to them. So it's best to start off just focusing on that one person, and then you can move on to things that are more peripheral and less immediately relevant. So there are three basic questions that you've got in working out what are you going to talk about in this encounter. What do you already know? What do you need to find out? And what do you need to tell the person you're speaking to? Those are all things that you can decide before you start. What should I have known about Jo? I know that she's got a positive test result. I should have known her date of birth and her address so that I could confirm those things with her. I need to find out if she's got any contacts, who's at home with her, who else is at risk, whether she's had any symptoms. And I need to tell her, firstly, that she's got a positive result, but also that she needs to self-isolate, and if she's got any more concerns, who to contact, and all these other bits of information that are going to come up. It's not just about that one test result, but there's other information around it. So in the introduction, as I've mentioned, we need to confirm if it's the right person. I need to ask, hi, is that Jo Dodds? This is Neil Coburn speaking from Sandwell Council. I'm one of the public health doctors there. I just wanted to talk to you about a test that was done recently, but before I go on to that, can I just check your full date of birth, please? And your address, is that 262 Grafton Street? Okay, thank you very much for that. Now I just wanted to ask a couple more questions to make sure that we're on the same page before I go on to talk about the test, so on and so forth. So it naturally leads into the information gathering part, but it also sets up what Jo should expect for the next part of the encounter, what the overall point of the encounter is, and these sorts of questions that she'll naturally be thinking of. And by answering them early on, it just helps things to flow a little bit more smoothly, and for her to be patient while I'm gathering the other information before she gets the bit that she's interested in, which is the test result. Now, in terms of that information gathering section, how you ask questions can actually be, there can be an art to it. Asking open-ended questions. Have you had any symptoms? Have you been unwell in the past few days? That lets Joe talk about, what she's actually had, instead of saying, have you had fever? Have you had cough? Have you had, asking closed questions kind of limits what Joe is able to tell you, and what she will be able, and her ability to kind of input into the whole encounter. And similarly, when you're listening, it's important not just to sort of get down the information, but to show that you've listened and that you're actually hearing what Joe is saying. So there's lots and lots of ways of doing that. Just non-verbal responses. Well, obviously it'll be on the phone, but verbal responses can be very important. Okay, thank you for telling me that. Summaries are also very useful once you've gathered all the information that you want. So, Joe, you've told me that you've had a bit of a cough the last couple of days. That started 2 days ago. You've not had any other symptoms. You've got a partner and a child who lives at home with you. Is that all correct? That's all I needed to know. Thank you. So, showing that you're listening to people that's an important part of being human. It doesn't necessarily help you straight away to kind of get more information, but later on it can help with when you're negotiating and planning and asking someone, please self-isolate for 7 days. They know that you've already taken an interest in what they're saying, that you've got information, that they had symptoms 2 days ago and that you're taking it all in. If you've already been actively listening earlier on, that makes it far easier for all that to go in. Any questions at this point? Yeah, absolutely. So Gareth has asked what happens if someone refuses to give you details, which is obviously, and that will come up right at the start of the consultation. It's really important to be establishing some degree of trust, and it's perfectly reasonable for people not to trust you straight away. So if I call up and say, hi, this is Neil Coburn speaking from Sandwell Council, I'm one of the public health doctors. For some, that can be a ripe target for fraud and for people to use kind of for contact tracing scripts and things like that. It's not unreasonable for people not to trust that, and so it's important to allow people to say, actually, I'm not comfortable with this yet. Can you? But then what do you do about that? One of the things is to ask them to call the council or call a supervisor with a number that they can find publicly availably. So if they can, if we're setting up this system where we're going to be asking people to do contact tracing, we will put these arrangements in place. But if they say, I don't trust you, can you confirm your identity? One of the things you can do is say, can you search Sandwell Council's number online, call them and ask to be put through to this person? Then you'll be able to confirm my identity. Most people will be happy with your introduction, and it also helps that you've got details, important details about what's going on. So their name, date of birth and address. Quite often when I dealt with patients, I would say, so you're Joe Dodds, can I check your date of birth and your address is 262 Grafton Street. It's important that you don't give people personal information away until you're happy with the identity. So I shouldn't say, hi, is that Joe Dodds? Your date of birth is so and so. Your address is so and so. That's giving, a stranger can just say yep, and you've given away all that personal information. So it's important to keep it, not to give information away until you've established the identity, but also signposting that you've got that information can help to build some of that trust. Does that answer your question, Gareth?
Hi Neil, sorry, I stay on mute because I've got a small child running about at this end, but it does answer my question partially. It's a better answer than was given on a radio show from somebody the other week, which was you just have to be convincing, which I think is, that's the rationale of people who do
conning,
fraud, isn't it?
Yeah.
So
Absolutely.
It's certainly a bit clearer than that. I mean, as I've said, I for one, I don't tend to answer calls I'm not expecting, and certainly don't hand over personal details. So I can just see it being a sticking point. That's all.
Yeah, absolutely, and it is a problem that the national contact tracing system is facing. For example, in some regions, in Sandwell, we don't have not everyone is answering the calls from contact tracing, and not everyone is contactable. We do. That's why it's important, firstly, that we build the trust. But the second point is that if you are able to engage someone on the phone, as long as you've established their identity, you don't necessarily need to you don't need to ask them for any other information. Although it helps to know where what their symptoms have been, and if they've got any contacts in the home, you can just tell them about the test result and make the plan around that. And sometimes after that, you'll build a bit more rapport and a bit more trust and be able to carry on with the other things that you want to do. But ultimately, you have to do what you can with the tools that you've got.
Yeah, that's fine, thanks. I mean, I'm assuming if somebody's had a test, they're more likely to speak to you than if you're just ringing them on the basis that you're contacting them as somebody has said they've been in touch with them, in which case they may not be expecting a call.
Yes, yeah, and that'll get trickier. And
yeah.
Okay,
that's great.
Thanks for that. Ali, you've got a question.
Just adding to that point, I think one of the things that you can build the rapport if you call from, I mean, this is one of the issues with the contact trace nationally, because they're remote and they people are not related to it. Whereas, say, if our Healthy Sandwell team can give them a call, they already build a good rapport locally. And if they say, we're phoning you from Healthy Sandwell Local Council, I'm sure, people can relate to an organization that they already dealt with and they know it locally. And that would be hopefully the extra benefit if we are involved in this, that people can relate and have some kind of rapport with the organization that contact them.
Yeah, absolutely. That's a really good point. And even just kind of having local knowledge, obviously being local and having local brands like Healthy Sandwell helps with that, and helps with that kind of recognition and rapport that you can build at the start. So we've had a couple more questions. So time limited conversations. So with the contact tracing, it will be a question of you take as long as you'll need to get the job done. In terms of discussing it in further detail, you wouldn't be expected to know lots of information you wouldn't be expected to be able to have a medical discussion to tell someone you're at high risk or low risk. And if people ask those sorts of questions, you need to just brush them aside and say, I'm sorry, that's unfortunately not something I'm trained to discuss or I'm in a position to discuss. But if you call 111 or contact your own GP, you can get information. There is information available on websites, NHS, etc. So while you won't be time limited the way a GP will be, there will obviously be there's so many jobs to do in the day for anyone anyway that you won't want to spend a long time in these conversations, and certainly not getting engaged in questions that you can't answer or aren't in a position to answer. Judith, you're asking about someone taking the call on behalf of a member of the household. So we'll come on to confidentiality in a moment, but I really want to emphasize this, that we shouldn't be giving personal health information to people to other people unless we've got explicit consent from the person who it belongs to. If it's a partner who picks up the phone, you don't give away information. You don't say, hi, I've got test results from the COVID swab, can I speak to so and so? You just ask, you can introduce yourself. Hi, I'm calling from Sandwell Council. Can I please speak to so and so? So really, you should, unless you've got explicit consent and you're happy with that consent, to share the information with someone else, don't give it away to someone that you don't have complete confidence in. Managing calls with language barriers is always complex. I speak Polish myself, so I often got called in to do consultations in Polish, and the standard of care I was able to give treating someone in their own language compared to using an interpreter was always so much higher. And so there will be interpreting services available where we need them. Ultimately, it will be difficult, and that's where kind of having clearly knowing and planning your consultations, your interactions, will make it a lot easier. So some calls made for Welfare Hub, people were having to take calls on behalf of other family members due to health conditions. Yes, so it can be difficult. Sometimes it's enough to just say, sort of ask if you can put the phone to someone else's ear and just say, are you happy for me to give this health information to your family member? Sometimes if they're really not able to speak on the phone at all, you can make a best interest judgment. But that's a bit more of a last resort, I would say. Ideally, you want to make sure that you do have consent that covers you and avoids sticky situations. Cross-checking patients in databases. In all honesty, we probably wouldn't be checking if people lack capacity before we speak to them. That will be if you're calling people up and you get through to a carer or someone else who kind of has best interest decisions to make, you have that sort of negotiation with them. But if you have any uncertainties, if you're nervous that you're giving away information to someone you shouldn't be, you can just stop the encounter, go and check, go and speak with a manager, and make sure that you don't, you can take time over it to make sure you get it right and that you don't give away the information by mistake. Okay, I will move on. So open questions and active listening are important communication skills to build rapport, but also to make sure that you don't miss information. So breaking bad news. This is going to be our information delivery section, and actually, to lots of people, having a COVID-19 test result isn't necessarily going to be bad news. We've had all sorts of experiences with the people so far that we've spoken to giving test results in the team. So some people get very panicky and say they're not going to leave the house for a month, and some people they're not even interested in self-isolating because they feel so well and don't think they've got any problems. By assuming that this is bad news in some way, you can deliver the information sensitively, you can make people take it seriously, and you can kind of get people's attention closely. It doesn't. Part of what you'll be doing by assuming it's bad news is actually sort of reassuring people to some extent that COVID-19 isn't a death sentence. Most people are okay. Most people will not die. Most people won't be severely ill. But if you have concerns, speak to your doctor, speak to 111. So it gives you a chance to also sensitively say that you're going to be okay. And to someone who thinks that they're totally fine and won't have any issues with COVID, if they're being told, don't worry, you probably won't die, that immediately makes them think, oh, maybe I should have been a little bit worried. And it's not to say that we want to be worrying people unnecessarily, but that helps them to take it seriously, to think, actually, COVID is serious. I need to self-isolate so that I don't give it to someone else. So in breaking bad news, doctors, often use a framework called spikes. And some of this is going to be relevant to the way that we're doing these encounters. So the first thing you do is set up the situation. That's our introduction. perceptions of the situation. That's where you're talking to the person and asking them, when did you have your test? Do you feel unwell? Those sorts of things. You're understanding what they kind of how they're currently feeling and what they're expecting. The invitation is about giving people the option not to hear this news right now. If you're telling someone that they have a test result, it's good practice to say, are you free to take this right now? Do you want to take this right now? Now, that might seem, I mean, we'll do that anyway with delivering test news, but where it seems more important is if you imagine someone who's receiving a cancer diagnosis, if they were receiving a diagnosis and they wanted someone there with them, they wanted a particular person to support them, then if you give them the chance to wait and not hear the news, they can get things in a more emotionally comfortable position. They can have the right people there, because remember when you're delivering these test results, it's not just about the result itself, but some of the information that comes afterwards. So while this will have nothing like the gravity of a cancer result, it's still really good to give people the choice to say, can you call me back later when I'll be a bit more ready for this? K is for knowledge, the actual information. You are positive for COVID. That means that you've got the virus, and you need to self-isolate for 7 days from the symptoms, so on and so forth. That's just the kind of really factual part. So that's something that you could plan out in advance and think, what do I actually need to tell people? Empathy is just about what's someone's initial reaction, and pay attention to it. Don't assume that people will all react the same way. So some people might get very upset and anxious, and you can kind of say, I understand this is upsetting. If you need to get more information, if you're worried, you can talk to 111 GP. It's not you don't have to kind of spend ages talking about how people feel, but you just need to notice how they've reacted. And finally, strategy and summary. So that's where you agree with the person that you've spoken to. I will self-isolate until this day. I will keep my household contacts isolated for 14 days unless one of them develops symptoms. And it go so on and so forth, so that you agree and make it nice and clear right at the end, what are the next steps? Where can I get more help? What do I need to do? Any questions? No, that's fine. So again, I want to emphasize, I'm not expecting you to have the communication skills of a better doctor, perhaps, by the end of this or anything. These are just a couple of useful tools that you'll probably follow most of anyway, but they can just be there to support you when you're kind of planning the first kind of encounters, and know how to proceed with some of the things that can come up. Using a breaking bad news situation kind of structure helps you to anticipate problems that can come up, and we'll come on to one or two other problems that can possibly come up, and we've touched on consent and confidentiality already. So when I was talking to Jo earlier on, I told her, you and your partner are both positive for COVID. And that was immediately breaking confidentiality. I did not have the partner's consent to give that information away. And it upset Jo, because suddenly she was thinking, well, which one of us gave it to the other? There was so much information that happened all in that one moment, and so many things to react to, that it unsettled her and left her quite upset. What we should be doing is, if you've got two partners who are both positive, you speak to them each individually. you treat them as two separate people instead of giving all the information to one of them. That's not the same for children, because if there were children who tested positive, then children don't have the same rights to consent and confidentiality. You would assume to go through the parents. But if there are other adults who you are delivering test results for, you can't give their health information away without their consent. And if you do, you can run into problems, you can cause fights. The classic, of course, is that we have in medicine is when you've got one partner has an STI and the other one doesn't, then the implication is that the partner with an STI has had an affair because they've contracted the disease outside of a relationship. So obviously we're not quite anything as broadly and obvious here when we're giving away a test result, but you still raise the question, kind of, did my partner give this to me? And it's not that we should stop people asking that question. It's more that you don't want to be involved in that, because that's a personal relational discussion that you shouldn't have a part of and that you don't really want to have to advise on. So again, just using good consent and confidentiality practice helps you to avoid running into sticky situations. Aggression. Unfortunately, this comes up in so many jobs all the time, and delivering test results can make people aggressive because they get upset. And then we're actually asking them to self-isolate for 7 days, and that can also get a bit of aggression back. That people can often, if you ask them to isolate for 7 days, they'll talk about all the things they're missing, they'll get upset. This is an aggression can be really hard to deal with. The first thing to say is remember that it would be on the phone, so you'd be safe. You don't need to worry about your physical safety in that moment. It can get you down. I totally recognize that, and it can be. I've certainly had some really tough interactions in A&E with aggressive patients, and you sometimes afterwards you just need to take time out, talk to someone, debrief about it. It can be a lot of emotions that you wind up internalizing, and so when you've got these difficult conversations, make sure that you ask for help and just talk to people to make sure that you're not doing lots of emotional work as well on top of all your extra work duties. The best way to deal with aggression is often just to stay polite, hear the person out, understand why they're angry, and just recognize it, show empathy, and then move on. You can't fix people's situations. Often the reason people might get aggressive would be loss of income, the stress of that. You can't fix that. You can maybe provide advice about where they can seek support, but you can't solve all of their problems. The most often that you'll be able to do is just listen, be sympathetic, and don't rise to it, because as soon as people have got something to be angry against, if you go hard, if you give them something to be angry against, it lets them get angrier. If you're very soft and polite and kindly, it's extremely difficult to be angry, no matter what you're going through. It's extremely difficult to be angry to people who are being nice to you, compared to people who aren't. And finally, don't panic. Most of these problems will never come up. They don't. A lot of these techniques are about avoiding potential problems and about getting things across in a good way, builds rapport and builds trust. You don't need to suddenly be able to employ all of them expertly. And we medical students, nurses, they go on the wards for the first time with none of this training. It's something they accrue over years. So you don't have to have all of these skills immediately ready to hand in order to be able to do these sorts of encounters. You can just these are just a set of tools that might help you plan your encounters, think about what might be coming, and think of how to avoid problems that can come up. So I'm gonna ask Joe to come back on now, and we're gonna role play the same situation again, but this time I'll hopefully do a slightly better job and just show you in action some of the things that I've talked about now. Are you ready, Joe?
I'm here.
Good afternoon. Is that Joe Dodds?
It is, yes.
Hi, this is Neil Coburn speaking from Sandwell Council. I'm one of the doctors at the council, so I work in public health there. So I understand that you've recently had a test done.
Yes.
Can I just double check before we talk about that, that you, can I check your date of birth, just to check who you are?
So it's the 29th of the 8th, 1983.
Lovely. And your address, is that 262 Grafton Road?
Yes, Medic, yeah.
Lovely, thank you very much. So I wanted to talk to you about I understand you had a test done recently for COVID-19, is that right?
It is, yes.
I've got the results of that, and I wanted to give you some advice around that. But just before we jump into that, can I just check, have you been unwell in the past few days at all?
No, I mean, I've got a bit of a cough, but to be honest with you, I have coughs on and off. I am a smoker, so other than that, I haven't had any of the symptoms that I've seen on the TV or social media or anything. So no,
Okay.
not really.
Excellent. And is there anyone else at home with you?
Yeah, so I've got my daughter, my partner as well. We all live together. There's the three of us.
Yeah, great. Is now an okay time to talk about the test? Are you happy for me to go through that now?
Yeah, so my partner's at work and my daughter's just in another room at the moment.
Okay, great. So I'm afraid that the test result, it has come back positive, which means that you have got the virus, the infection.
Okay. Oh well.
First thing I want to say about that is that it's not a death sentence. It doesn't mean you're going to become very unwell. Lots and lots of people have the virus and don't even have any symptoms. But obviously, if you do start to become more unwell, then make sure you do seek care, that you can speak to 111 or see your GP, speak to your GP. And there's more information about those sorts of things online, so you can look at the NHS website for more information about that.
Okay.
Now, obviously, because you have the virus, that does mean that you're infectious to other people. And so for that reason, we'll ask you to isolate for 7 days. So you don't go to work or leave the house at all for 7 days. Is that okay?
I'm worried about my job. I'm worried about my partner as well. He's at work, so I don't know what I'm going to do financially and how this is going to impact us.
Yes, of course, I completely understand. Now, it's obviously lots of people are aware that you have to isolate if you have the infection, and employers are generally quite understanding at the moment. It's obviously best to speak to your employer and let them know that you're going to be off work sick for 7 days. You can claim statutory sick pay for that time, and you don't need a GP's note or anything for that. You can just self-certify. And I'd also encourage you to, if you feel comfortable, to let your employer know, because sometimes it can help them just to be flexible and accommodating.
I will, yeah. I work in a shop, so I see quite a lot of people. So yeah, I will.
Absolutely. So obviously, there's no way you can carry on working if you can potentially be infecting all those people.
Okay. I mean, I haven't seen my parents, but my partner, does he need to be tested now? Because he's seen his parents a couple of days ago.
Yeah. So what I'd like to, I'll speak to him separately, actually, if that's okay. So I've got some contact details for him, so I'll speak to him separately. What I will say is that everyone in your household does need to isolate for 14 days from when you had the test.
Okay.
So because they aren't necessarily infected, so your daughter, for example, doesn't necessarily have the infection, but she may develop it. She may contract it from you. She may be brewing it, if you like, and so she may develop it during that time. If you go 14 days and she doesn't develop any symptoms or any infection, that means that probably she's fine. She's not contracted it.
So she doesn't need to have a test.
She doesn't need to have a test just for being in contact with you, but she will, if she develops any symptoms, then she should have a test.
Okay. And is it what about if she's under 5?
So again, I'm afraid, actually, I don't know off the top of my head what the arrangements are for testing under 5 years old. But you can find that information online through the testing portal. So where you register to get the test done, you can find all the details there.
Okay. Yeah. I've seen that.
Great. So I'll speak to your partner separately and give them some advice. Are you happy for me to tell them that you had a positive test?
Yeah, that's fine. Yeah, because I'll be telling him anyway, so that's fine.
Okay, great. So I just want to check that I'm okay to mention that when I speak to him.
Yeah.
So I'll give him some more advice as well about the similar around self-isolating.
Okay, thank you.
Do you have any questions for me now?
I don't think so. So I can get all the information from where I registered for my test, and if I go back there and look, and then can I speak to my GP if I need any more details as well, or?
Yeah, so particularly if you start to feel more unwell, particularly if you start to feel short of breath, I'd encourage you to speak to 111 or to your GP.
Okay, and my daughter's been going to school, so nursery, so do I have to tell them?
No, don't worry. So you can tell them. That obviously we wouldn't stop you doing that, but don't feel you absolutely have to. So because your daughter hasn't had any symptoms, she's just your contact. She's not necessarily infectious in herself. And so if we're concerned about the nursery, we'll call them up as well to say you might need to take additional measures. But in the meantime, you don't have to. They don't need to take any additional action. You can just tell them why she's off.
Okay, thank you.
You're welcome. Do you have any other questions for me?
No, I think that's it for now. Thank you. Thanks for letting me know.
You're very welcome. So just to confirm once again, you need to isolate for 7 days as you've not really had any symptoms, you need to isolate from the day that you had the test for 7 days. And your household contacts need to isolate for 14 days from that day, unless any of them develop any symptoms. If any of them get symptoms, it's 7 days from those symptoms.
Okay, thank you.
Okay. Thank you very much. So, any questions about any of that? Yes, Sally.
Yeah, I'm just wondering, when you mentioned you don't mention it to the nursery, would that positive case then we would need to know who they have been in touch with, and then that would form part of the test and trace tracking as well. So that do you know what I mean? Is this the point where we then ask them, have you been in contact with this and this?
Yes, absolutely. So we would be contact tracing Jo. We'd be looking at the shop to see who is. Does she have any colleagues there that she was in contact with for more than 15 minutes? Are any of the customers at risk? Those kinds of things we'd be looking into. And if we were contact tracing Jo, we'd do a much more in-depth questionnaire to try and get all the information about the people that she's been in contact with over the past sort of time period. Now,
how is that? Daughter, this is the point I'm not really clear about. So Jo now is positive,
yeah,
and now we want to create some kind of tracking list of something. Yeah. So would that be like, again, asking her to give out the information that she's been in contact with? Is that how we're going to be going with this?
Yeah. So you'd have a whole tool, you'd have a kind of form to work through. And normally actually what the National Contact Tracing System do first is that they send you online to start with to fill out all of those details. So you get all the information about who they've been in contact with, what kind of contact they had, and then the contact details of that person so that you can go and trace them. Now, it's important to notice that with Joe's daughter's nursery, Joe's daughter is a contact. She's not a case. So we aren't contact tracing her daughter. We're contact tracing Joe. So we don't need to worry about kind of everyone but her daughter has been in contact with, unless we're worried that she's a case. And that's, it does get a bit more complicated and nuanced in terms of how much risk is posed to the nursery, whether you can have outbreak going on there. But for the purposes of this session, the important thing to note is that you don't need to get sort of lots of information about her daughter's whereabouts and things. You just need to give her the advice that her daughter needs to self-isolate for 14 days. Is that okay? So Mary's asked about likelihood of having test results. So we at the council we have arranged some proactive swabbing, so that we've gone into a workplace to swab everyone in that workplace to see how many cases there were, and that's where we actually had all the information and the contact details. So we contact them in the first instance to give them the test result. That then went to the national contact tracing system to do all the trace elements, but we were actually giving the test results and that initial advice straight away. You need to self-isolate because you tested positive. So now, Mary, you've also mentioned Lisa's article, and if anyone follows Lisa on Twitter, you'll notice that Lisa is quite keen to have more details about the people who are being traced, and that Sandwell has lower rates compared to other local authorities of response to trace systems. So we're looking at ways of how can we boost that? Can we take it into our own hands and do a better job? And that's part of what this session is feeding into. It is just giving you some of the tools for how to actually conduct those conversations. And if you're having to give information, test results at the same time as tracing, you've got a sensitive approach for how you give the information, which then builds rapport and builds trust and makes people more likely to give you their contacts as well. Does that answer your question, Mary? Any other questions? Sarah?
I was just going to ask about the instruction to self-isolate. So I think when my daughter had symptoms, there is quite a lot of guidance about how you should manage that within your home, because as the person with symptoms, the instruction for her to self-isolate is a bit different to the rest of the family isolating. Yep. So would you go into that level of detail, or would you just refer them to look at the national guidance?
If we're asking you to be delivering these kinds of test results, or doing any tracing, we'll provide a clear script, and we do actually have one already prepared for exactly all the information that you need to be providing to people.
Okay.
It is good to also provide additional information. You're just on a phone call, they've just received some news, they're not necessarily going to be taking in lots of information. So it is good to also signpost people towards that kind of guidance. But part of the reason for doing the calls in person is to re-emphasize that if she's got symptoms, if she's tested positive, she needs to self-isolate. She should be isolating away from the rest of the household as well if the rest of the household doesn't look like they've got symptoms. But the most important thing is to keep it contained within the house.
Yeah, thanks.
Okay. If there are no more questions, we'll close up there. The slides will be in the usual folder, and I'll put some links and more details in the notes section of the slides, so you can follow that up if you want to read into that in any more depth. I hope this has been helpful. Once again, I don't want to scare people by going into depth of what can happen. most of this is very unlikely to happen. This is just about equipping you with some of the tools of what to do if it does. Thank you very much.